Hello, everyone. You are welcome to my YouTube channel. I'll be discussing the topic Ascariasis. Ascariasis is a nematode infection or disease caused by the nematode parasite called or named Ascaris lumbricoides. It is the largest intestinal nematode parasite of humans, reaching up to 40 centimeters in length for the female one. Most infected individuals have low warm bodies and are usually asymptomatic. Briefly look at the life cycle of Ascaris lumbricoides. The adult worms, male and female, live in the lumen of the small intestine where they absorb nutrients or freshly digested nutrients. The mature female ascarid worms are extraordinarily fertile, each producing up to 200,000 eggs a day, which are passed with the feces. Both fertilized and unfertilized eggs are passed and are important in the diagnosis of ascariasis. Ascarid eggs become infective after several weeks of maturation or embryonation in the soil and can remain infective for years. Humans may become infected when the fully embryonated eggs in contaminated food and water are swallowed. Then the ingested eggs hatch in the duodenum and the larvae penetrate the intestinal wall and circulate in the blood. From the heart, they migrate to the lungs, ascend the trachea, descend to the esophagus, and finally reach the small intestine to become adults. Between 2 and 3 months elapse between initial infection and egg production. The adult worms live for 1 to 2 years. Here is the life cycle of Ascaris lumbricoides, with the adults in the small intestine, the male and the female. Following fertilization of the eggs are passed in the feces, and then in the soil where they undergo embryonation or maturation. Here is the fertilized egg of Ascaris lumbricoides with the marmorated albuminous coat and is over, while the unfertilized egg, which will not undergo further development. So the fertilized egg undergoes embryonation. Here you have 2-cell stage, multiple cell stage, and then the fully embryonated egg with the effective larvae, L3 larvae, or the 3rd stage larvae, which is ingested with the food or water that is contaminated. The larvae are covered up following hatching in the small intestine and then re-enter the gastrointestinal tract. The maturation proceeds in the small intestine. Epidemiology of Ascariasis. Ascaris is widely distributed in tropical and subtropical regions as in other humid areas. Transmission typically occurs through fecally contaminated soil and is due either to a lack of sanitary facilities or to the use of human manure known as night soil as fertilizer. Younger children in impoverished rural areas are most affected with their propensity for fecal to mouth fecal carriage. What are the clinical features of ascariasis? There are 2 types of clinical features based on whether it is the adult worm causing the clinical manifestations or the migrating larvae. The adult worms in the small intestine cause malnutrition in children because they absorb the digested nutrients, fatty acids, amino acids that are supposed to help in the growth of children are absorbed by these worms. The adult worms cause abdominal pain and may cause intussusception, intestinal obstruction, especially in children. The larvae in the lungs may cause inflammation of the lungs, known as Loeffler syndrome, pneumonia-like symptoms. Patients may develop an irritating, non-productive cough and burning substernal discomfort during the long phase of larval migration, about 9 to 12 days after egg ingestion. Dyspnea and blood-tinged sputum are less common. Fever with body temperature exceeding 38.5 degrees Celsius. Eosinophila develops during this symptomatic phase and may subside slowly over weeks. Where there is seasonal transmission of the parasite, seasonal pneumonitis with eosinophilia may develop in previously infected and sensitized hosts. Laboratory diagnosis of ascariasis. This is by the microscopic detection of the characteristic marmorated ascaris eggs in fecal samples. Occasionally, patients present after passing an adult worm, which is identifiable by its large size and smooth cream-colored surface in the stool or through the mouth or nose. Larvae may be found in sputum or gastric aspirations or gastric aspirate, before diagnostic eggs appear in the stool during the early transpulmonary migratory phase when eosinophilic pneumonitis occurs. Prevention and control of ascariasis. One, proper disposal of human feces, and then farmers should stop using human feces, known as night soil, to fertilize vegetable gardens. Ascariasis should always be treated to prevent potentially serious complications. The drug of choice is usually albendazole or mebendazole, but these benzimidazoles are contraindicated in pregnancy, and so parental palmate is safe in pregnancy. These are links for further reading. Thank you for listening.